The management and supervision of work, who the employer is responsible for that, and compliance with the legislation. We can enter names of the radiation protection supervisors, going to our add button again. So there may be more than one radiation protection supervisor. We can add those details in. As we proceed down the page, radiation protection advisors are also hardwired in because you have a radiation protection consultancy contract with DD. We have an area where you can enter the names of the people allowed to operate the X-ray equipment itself, adding names in. We then have some tick boxes for the description of the controlled area. Designation of controlled areas is an issue that should be discussed with your RPA, but as a general rule of thumb, the top option of the whole of the room in which the X-ray set is installed is most likely to be the most relevant to yourselves. However, please feel free to consult with your RPA. We have more tick boxes in terms of the controlled area is considered to exist during the following two states. We then move on to the working instructions. So these are, as it suggests, working instructions for people in the practice to adhere to. We talk about personal monitoring. We talk about where people should be positioned during exposures. We talk about access restriction, how you stop people entering controlled areas during radiography or when the area is designated as being controlled. We talk about which areas should the X-ray beam directed at and which it should not be directed at. How the equipment is put in a state of unreadiness to emit X-rays. Where two X-ray sets are installed in the same room, we can have information to here. How is it achieved that you cannot operate both pieces of equipment at the same time? We have written arrangements for non-classified workers entering controlled areas and how that is achieved. The dose investigation level, which is recommended as 1 millisievert in a calendar year for dental practices. If you have made a decision to pick a different value, then you may need to adapt these local rules. Again, that should be discussed with your RPA if you've taken that approach. Contingency plans, these are what you should do if something goes wrong. So such as a continuous generation of X-rays following a preset exposure. What service and maintenance and repair arrangements are in place? What arrangements are in place for pregnant workers? What the duties of the employer are? And instructions for another employers working in your controlled areas, should that need to be the case. So the whole template is there, it can be completed online and saved and printed, or you can just use this as a template to base your own local rules on. Moving down on the left-hand side, we have local rules for handheld equipment. So again, this is for battery-powered units, and we just click in the Add button.